Sometimes people would come along to me and say that they'd found a lump on their testicle, or sometimes their carers might say that they'd found the lump. So it depends on what level of disability the person has in the first instance as to whether they're able to describe the lump that they found. So then what would happen is that I'd try and get a little bit of history as best I can in terms of how long the lump has been there, is it painful, is it firm or soft, does it move around, but not too many questions, but just a little bit to try and get a feel of whether this is likely to be a more serious or a less serious problem. It's probably important to say at this point that men frequently find smallish lumps in their testicles, and most of the time, I would say 99% of the time, these lumps are innocent. But it's hard to find out whether a lump is innocent or not without actually examining a patient or perhaps even doing some more tests. If somebody came to me with a testicular lump, I'd have to explain to them that after having a bit of story, I would need to examine their testicle. And so to do that, I would ask them to lie down flat on their back on a couch with somebody with them to support them that they were comfortable with, because not everybody wants to be examined undressed with say a female carer present or something like that. So I'd also offer a chaperone to come in, maybe one of the practice members of staff, maybe another doctor or a nurse to come in and support the person. So I would need to ask them to take their trousers and their underwear down, all right? And then it shouldn't be an uncomfortable examination, but it's obviously a little bit embarrassing. And I would just gently feel each of the testicles and roll them around between my fingers just to feel the size, see that they're the same size. I want to just check the little bag of tubules that sits on top of the testicles. So that's just feels like some little veins or a bag of worms, people sometimes describe it as. And again, that's normal. And sometimes that can get little lumps in and they can be quite tender. So it's about looking for that. And then I then have to make a decision whether what I felt is normal or not. And if I don't think it's normal, then we decide if we're going to do some tests, okay? And the test that we would do first off is an ultrasound scan test. That's the main test that a GP would ask for if somebody found a lump in their testicle. I would only do blood tests if somebody had actually been feeling unwell as well. So, say they'd lost weight, or they just, their appetite had gone, or they'd started to look quite pale or been sleepy all the time, some additional symptoms. I wouldn't normally do blood tests for just a lump, because, as I said, 99% of those lumps are entirely innocent, and blood tests wouldn't actually give us any extra information. So the first thing to do really is to find out as much information about the lump, and an ultrasound scan, which is an ultrasound scan, it's like a soft probe, like the one that a pregnant lady would have on her tummy, with a bit of jelly on the end, and then they would put that on the testicle, and that would help them have a good look inside, and they can check for fluid, they can check for cysts, which are sort of like little sacs with fluid in them. They can check for all manner of things, but they can also check for things like testicle cancers, and that's the thing we're most worried about. Now, again, it's important to say that testicular cancer is extremely rare, but it's one of those cancers that's very, very treatable if we pick it up early. So we sort of want to look for it, even though we know that we're not going to find it that often. So on the rare occasion that a scan would come back confirming something that was, unpleasant, like a testicle cancer or something like that, well then there's almost an automatic procedure that we would get informed quite quickly. In some areas there would be an automatic referral made to the urology doctors, who are the doctors that would treat it, but as soon as I find out about it, I'd either want to make sure that there's an arrangement for an appointment, or I do something called a 2-week referral. So that means that, you know, I ring the hospital, I fax a letter through to make sure that the consultant would see the patient at the hospital within a week or two to make sure that the treatment was going to be started on. Now, if it's a certain lump, it will require a certain treatment. So different lumps have got different treatments. So if it's fluid collections, well then they can be treated by aspirating the fluid or drawing the fluid off with needles under local anaesthetic or general anaesthetic sometimes. If it's something more sinister like a cancer or a likely cancer, well then the hospital doctor would be discussing the latest treatments that might involve surgery, might involve X-ray treatments, it might involve taking what we call chemotherapy, which is very strong medicines to try and kill the cancer cells. But that would all be discussed by the consultants when they saw the patient about what would happen next. And when you go to the hospital, if you've got a learning disability, I would be telling the hospital that you had that learning disability and telling them what you needed in terms of support, whether you needed the learning disability nurse to be with you, or whether you needed extra time, or whether you needed information in easy read format, or whether you needed somebody to stay with you in hospital. All those sorts of things, if I know about them, I'd be writing to the hospital to tell them they needed to do those things. As a GP, I never lose sight of my patients. So even when they're being treated by surgeons and consultants in hospital, I get a letter every time they're seen, and I am the person that is best placed to coordinate all the different people that might be involved in somebody's care. So if somebody needed a big operation and they needed some chemotherapy or some radiotherapy, well then there might be lots of different doctors involved, or they might need a different care package at home. So it's my job to just sort of see the patient now and again with their family or their carers if necessary, and just check that everything that should be coming together is coming together. So even once somebody's been seen by the hospital, it doesn't mean that I don't have any responsibilities. I do, and it's really important for me to continue to see the patient. I can still do their prescriptions, and I'll be wanting to check and see how things are going.